Good morning, everybody. Welcome to GW Center for Integrative Medicine YouTube channel. I'm your co-host, Dr. Kogan, Chief Medical Officer, Associate Professor of Medicine at George Washington University in Division of Geriatrics and Palliative Care. And that title actually is quite fitting for today's presentation. But before we jump into this, Happy New Year. I hope you had a wonderful celebration of the 2025. I hope we all moving into the new year with hopes and dreams and expectations of something greater and better. And of course, if you're in a snowed-in area and you do like the snow, like me, I love the snow, I love skiing, then you're enjoying this unusual for at least District of Columbia, the DMV area period when we have quite a lot of snow on the ground. But the topic is difficult. So it comes up quite often when patients or relatives or loved ones bring their loved one to our clinic, particularly to memory clinic or to our memory program. And the patient has been diagnosed recently with dementia. Most of the time, it's Alzheimer's disease. It's a really important question. Well, how much time does someone have? And quite often, this discussion is a bit hard to have for a variety of reasons. There hasn't been a superb data in the past as to sort of what to expect. There also hasn't been a data that's quite updated since, there's been quite a number of developments in the last 5 to 10 years in terms of drug market and some of this newer metabolic protocols, including the recode that we use in our clinic, and also some of this new techniques, 40 hertz light therapy, red light therapy, a variety of neurostimulation with different gaming, with different things. And of course, understanding of how some of these intricacies between different triggers of Alzheimer's lead to the final outcome, a dementia. And I'll put the links to some of our work. Those of you who follow us closely know that we're pending a first peer review publication in one of the top integrative medicine journals. And we'll be working on submitting more of our data of our work. But anyway, so this is, let me share my screen first of all, and present this study. So this is a very new study. It just came out. It's titled Time to Nursing Home Admission and Death in People with Dementia, Systematic Review and Meta-Analysis. So when you see this word systematic review and meta-analysis, it means that the authors of the study have collected data from other studies and they used the special methods to include only studies that they deemed appropriate. And I'm not going to go into details of the actual statistics, into details of how this was set up. The video will be too long, and frankly, I don't think it's going to be all that critical. I'll just say that, look, this is a British medical journal, the top journal, one of the top journal in the world. It's kind of a similar to, I guess, would be a JAMA in Journal of American Medical Association. It'd be kind of similar to that. So what they did, and by the way, this is just came out a few months ago, back in November last year in 2024. So the researchers analyzed almost 20,000 patients, and there are more than 5 million in all over the world. And they looked at statistics pretty thoroughly. So they said, look, what's the difference between men and women? Is there a difference between different parts of the world? And what they found is that if you are a man and you're presenting, and so they did these brackets at age of 65 and age of 85, and then you can extrapolate in between what happens. So if you're a man and you're presenting at 65, your expected average life expectancy is 5.7 years. And if you're presenting at 85, it's only 2.2 years. And this is really important. You think of this. And in typically, a lot of the people would present with Alzheimer's in their 80s, and often there's a sort of unspoken, oh yeah, but it's an early stage, right? The person's going to live for 10 years. No. Unfortunately, what we think that the standard of care for the Alzheimer's is not very good at the moment in terms of longevity of patients. Maybe the palliative approaches are good now and patients are comfortable, but the fact that they will not be living long. Now, if it's a woman, it's a better statistics, as you can see here. So At age of 65, it's 8 years, and age of 85, it's 4.5 years. So women's going to live longer. And the last 1/3 of remaining life expectancy in each category would be lived in a nursing home on average. So basically, more than half of the people across the world will end up in the nursing home for obvious reasons. Most of the time, family, as disease progresses, are going to have a very, very difficult time to maintain patients in their home and environment. I find it very, very interesting that median survival was much better in Asia than in US, and that is despite all innovations in Alzheimer's. You would expect that patients in Asia are just not getting the same medications, not getting the same urgent matter needs met. Like, you have a urine infection or you have some kind of other infection. In America, the patients go to the hospital quicker probably and survive. The issue is that it's not about that. Once this starts happening, the survival is very poor. Most patients probably have just months to live once they start developing multiple infections. And it's just the care. It's a custodial care that's a lot better. Typically, people in Asia tend to stay with the families. That stimulates them better. They seem to have a longer life. So with this in mind, can we do better? Let me stop sharing. Well, we can. Again, we're publishing our data that our mortality is dramatically improved. We now have a number of patients who are living past 10 years with advanced illness. We have some cases of survival beyond 20 years when patients presented with moderate to severe Alzheimer's in their 70s and even 80s. And those patients, despite life expectancy, like we have one particular case of Phil, and I'm allowed to say his name and his story. Phil presented in his 70s, in his early 70s. Actually, it was more like 73 or 74. And he lived under my care for 15 years, and he already presented with advanced dementia. So we know we can do a lot better. We know that if we modify the drivers of Alzheimer's and not concentrate on a sort of just palliating the symptoms, giving medications that either treat the plaque, the newer medications, or treat medications that support production of acetylcholine or any medication. So if we put them on this aggressive protocol, people live dramatically longer. Their quality of life seems to be a lot better too, simply because they don't have frequent infections, they don't have frequent problems, and they don't end up in a hospital that frequent. So I hope this has been helpful. Of course, we're going to put links to the video in the description. I will also summarize it a little bit, and I'll put some of these numbers so that it's helpful in case this ever comes up and your friends or somebody, your acquaintances, and you want to share this data with them. By all means. Stay well, live your life so that you don't get dementia, practice prevention methods, keeping your brain healthy. And of course, we have lots of resources on our YouTube, but also there's lots of other resources, and you can also visit our website, gwcim.com, to learn more. Thank you, and stay well, friends. Goodbye.